Imagine you're at a very important black belt test. You're doing well and you're breathing hard, but you start to realize that you can hardly breathe. It gets worse and it feels like you're choking on your own throat. After over a minute of barely breathing, you start to be able to regain your breath. This happened to me, and this happens to a lot of people. This is called Paradoxical Vocal Fold Motion, or PVFM. PVFM can be an easily treatable breathing disorder that is unknown, pretty much unknown, common, and often misdiagnosed, limiting many people from daily physical activities. Today, I'm going to tell you what PVFM is, some causes for it, and some treatments. Well, what is PVFM? In order to understand PVFM, you need to know a little bit of anatomy. Your vocal cords, or vocal folds, sit about where your Adam's apple is, on top of your trachea, which attaches to your lungs. Normally, when you breathe in, your vocal folds open. But sometimes, paradoxically, they close, limiting any air that you get in to hardly anything. PVFM is different than asthma. With asthma, you can't get your breath out, whereas with PVFM, you can't breathe in. PVFM is more prevalent than you may think. In a study by Abraham, Girani, and Raza, up to 27% of people complaining of breathing problems actually had PVFM. Dr. Godding from Lions Voice Clinic in Minneapolis estimates that half of his daughter's soccer team actually had PVFM. PVFM is twice as common in women and can commonly be seen in athletes, such as yourselves. My sister-in-law, Dewey, was diagnosed with asthma when she was in junior high. She used an inhaler, but it never helped her. Only recently did she get diagnosed with PVFM. Now she knows easy breathing techniques and she can finally go on runs. What are some causes of PVFM? Well, there are three main causes of PVFM: reflux, psychological issues, and exercise. Reflux-induced PVFM is when stomach acid comes up through your airway and reaches your vocal cords. Your vocal cords are made of sensitive tissue and they spasm and close when the acid reaches them. This can sometimes be seen in infants and may be a cause for SIDS, sudden infant death syndrome. Psychological induced PVFM is when you have a lot of anxiety, stress, or panic attacks. Those things can all cause your body to tense up and your vocal cords to close, making your panic attacks worse. The most common cause of PVFM for our age group is exercise. Exercise-induced PVFM happens when you're strenuously exercising, and it can sometimes cause your vocal cords to close from your breathing so hard. Inhalers don't help any of these. So, what can we do? Well, it is important to know that PVFM is often misdiagnosed as asthma. PVFM has really only been recognized in the last 20 years and is still unknown to many doctors today. So, what do you do if you think you have PVFM? You need to get diagnosed by an ENT, an ear, nose, and throat doctor. They may use a laryngoscope, which is a tiny camera attached to a tube. They would put it up through your nose and down to your vocal folds to see how they open and close when you breathe. If you don't want to go to an ENT right away, but you think you might be having a PVFM attack, you can try the quick test, which is if you can breathe easier by inhaling through a straw, or like this, then you may have PVFM. What are some treatments for PVFM? Well, there are three main treatments for PVFM corresponding to the three main causes. For reflux-induced PVFM, it is best to change your diet and look into medications. For psychological-induced PVFM, you should get counseling or see a therapist. Speech therapy helps mainly for exercise-induced PVFM. They may teach you easy breathing techniques to allow you to breathe deeper and more easily when you have an attack. In summary, we now know that PVFM can be an easily treatable breathing disorder that is virtually unknown, common, and often misdiagnosed, limiting many people from daily physical activities. Now, we also know that there are 3 main causes and 3 main treatments for PVFM. By spreading this newfound knowledge, we can help people who have PVFM. We no longer have to feel like we are choking on our own throats. Thank you.